Madam Chair, my Senator Monning. Thank you for your patience and your time in this hearing today. My name is David Mulvey. I'm with the SEIU Developmental Disabilities Council, and I've worked in the field of developmental disabilities for 40 years. And I think it's incredibly sad that we're here today to talk about how to make sure we provide providers with enough income that they can pay their workers minimum wage. That's the wrong standard to be using when we're talking about the kind of talented and dedicated people we need to provide quality services in our community. Just a quick example, I've been talking to some workers here in Sacramento recently, and their agency pays more than minimum wage, but in order to do that, they had to cut back on benefits. And so all the new hires for that agency are hired as temporary substitute workers, and so they receive no health care, no vacation, and no sick time. So we've got single mothers who are faced with the decision of staying home with their sick children or going to work and earning a paycheck that they need to pay their mortgage. It's just not right. We need to change the way we fund programs, and we strongly endorse the recommendations of the Lanterman Coalition to begin that process.
Thank you very much. Next speaker.
Madam Chair, Senator, my name is Boyd Bradshaw with Res Coalition. We are a member of the Lanterman Coalition, and because my colleagues have been so effective in articulating a number of the other issues, I'm going to cut to the chase here. We want to go ahead and point out that the Department of Developmental Services is working on the minimum wage issue, but they have been quiet on the arm rate structure and any changes to the arm rate structure. While they have come to us and indicated that they are working on it and have opened a dialogue, we are concerned that they are ignoring the fact that the arm rate structure was designed for 6-bed facilities, and yet we now have regional centers that are mandating these arm rate fundings to 4-bed facilities. To give you a quick example, level 2 facility is required to have 722 hours a month. That's 6 beds, 722 hours a month of staffing. A 4-bed level 2 facility is required to have the same number of staffing hours. You need to make sure that there's a designation for the minimum wage increase for 4-bed facilities. Thank you for your time.
Thank you very much.
Good afternoon. I'm Richard Greenwood. I'm a case manager service coordinator from North Bay Regional Center, and I'm also a member of SEIU's DD Council. I've been in this field for off and on for many years, 30 years at least, 19 years currently at the Regional Center. And I was involved actually with Peggy many years ago to establish the caseload standards that are in the Lanterman Act. And since 1999, they've been watered down. It was a period during this last budget crisis where they were completely suspended. They've been restored just this last year, the standards I'm talking about, but they're not being enforced. They really, the first few years they were enforced, but since then they're not. And as you've heard, caseloads are off the charts. I think we're in danger of, again, losing our federal funding if we don't do something about the rates for the core staffing formula is way out of date for regional centers, but also the programs in the community, those rates need to be adjusted too. And every couple of years there's some budget problem that comes up and we're told that, you know, we can't do something to correct the problem. I don't think we have that excuse anymore. It's time to do something to keep the promise.
Thank you very much. Hello.
My name is Lori Cole, and I'm an early intervention worker at North Bay Regional Center. I've been there for a gazillion years. I wanted to say today about talk today about the Early Start program and to request that you roll back the many and confusing changes that were imposed with the 2009 trailer bill language. Need to have the high-risk category reinstated and reinstate the 1/3 age delay or age range delay, whatever you want to call it, for infants and toddlers with delays for obvious reasons. Statistically, our agency gets in about 100 referrals a month across 2 offices. Before 2009, 10% of those, or maybe a little bit more, were not eligible. Now 50% of those are not eligible. So do the math if you're trying to figure out some statistics. The other thing that's kind of had a bee in my bonnet about is the requirements for the use of insurance for medical services that was on the 2009 trailer bill. This is not the autism one. This is something different. It got very confusing at the regional center. The developmental and educational use of speech therapy, occupational and physical therapy are not considered medical services. They are services that are free for our families and do not have to use insurance, for our families who receive services through our school-based infant programs. And so it became very confusing for them to have to use their insurance for physical, occupational, and speech therapy for other early start programs. Thank you.
Thank you very much. Hello.
No. Excuse me. Madam Chair, thank you for the opportunity. My name is James Astorga, and my family and I are residential care providers for clients of Alta Regional Center here in Sacramento. We support the Lanterman Act and the Lanterman Coalition letter and support our clients, most importantly, support our clients' rights to continue to live and be part of our communities. Please help us to keep our care homes open for the thousands of clients with developmental disabilities that we serve across California. To keep our doors open, we need your support to secure adequate funding and raise our rates by at least 12% due to the increases in minimum wage costs in July and in January 2016. Please invest the necessary resources in the community. We are counting on your support so we can continue to be partners in providing quality residential care to our clients. Thank you.
Thank you. 55 seconds. Perfect. Thank you. Good afternoon.
My name is Joella Chico. I have been a care provider for 12 years now. As a member of United Filipino Care Providers and Caregivers, I support the Lanterman Act. We have been voiceless for so long. As Filipinos, our cultural beliefs preclude us from exercising our First Amendment right to free speech. In the past, we were content working quietly behind doors of our facilities. Now we have to be fearless. We are taking bold steps to advocate ourselves and our clients. They are part of our family. When facilities close, clients are relocated. Adapting to new environment is difficult for this most sensitive population. We want to continue providing a stable home-like living environment for our clients, and we need your help by granting a substantial increase in funding to keep our facilities open. Thank you.
Thank you very much.
Hi, my name is Nympha Segovia. I have been a care provider for 28 years. I'm also a member of the United Filipino Care Providers and Caregivers, and I support the Lanterman Act. I am here to read a sample of job posting for my facilities. Position, direct care staff. Job description, duties required are similar to a nurse, social worker, behaviorist, therapist, activity director, personal shopper, educator, entertainer, counselor, job coach, nutritionist, personal trainer, peacemaker, cook, bookkeeper, housekeeper, Santa Claus, gardener, driver, friend, parent, and caregiver. Rate of pay, $8 an hour. Anyone interested, please see me after the hearing.
Thank you very much.
Thank you.
Senator Ellen Corbett, ma'am, sir, we would like to thank you for giving us the floor this afternoon. My name is Eileen Cantorfermo, and I'm a care provider for intellectually disabled consumers. We support the Lanterman Act. We support our clients' rights to live in the community. Please do not view us as merely your vendor or care provider or caregiver. Please consider us your partner. We Filipinos play a dominant role in healthcare. You see Filipino doctors, nurses, caregivers in hospitals, skilled nursing facilities, intermediate care facilities, and in residential care facilities across California. Please keep us open for business. Please support the minority small business owner. Thank you.
Thank you very much.
Good afternoon. My name is Celeste Salvador. I'm one of the care providers from Alta California, and I've been in business for more than 10 years. Now, my clients are really telling me all the time they don't like to go back to institutions and they'd like to live with me, and they never left my facility since I started it. And also, I have already 3 people, elderly who passed away, but still, I'd like to serve these old people despite my disability myself. I am going to continue helping all the elderly with special needs as long as I can live, and I am a support of the Lanterman Act. Thank you.
Thank you very much.
Good afternoon. I am Angel Fermo from United Filipino, and I am a care provider for the past 15 years. We support the Lanterman Act and support our rights to live, our clients to live in the community. Right now, the minority small business owners are facing so many challenges, and more of our providers are closing their care homes. We serve over 24,000 vulnerable, intellectual disabled clients. Our clients are happy living with us in the community. If we will close, where will they go? We want to continue our service to our clients, but we need your help. We asked 12% rate increase due to the minimum wage increase in July 2014 and another 12% in January 2016, as we are labor-intensive small business and earning minimum wage. Thank you.
Thank you very much.
Good afternoon. I am Fred Patawaran, and I'm a care provider for medically fragile and intellectually disabled clients. We support the Lanterman Act. We support our clients' rights to live in the community. We seek for your help because if a care home closes, everyone loses. Long-term consumers are immediately relocated and can impair their health and safety, as transfer trauma is well documented. Care providers and caregivers lost their livelihood. Home goes to foreclosure and sits in the market, causing blight in the community. Please say yes to 2 years moratorium to labor and vendor audit, as we want to comply but needs reduction, re-education, especially on labor law and wage orders. Thank you very much.
Thank you very much.
Good afternoon. I am Lou Patawaran, and I'm a care provider for over 20 years for the medically fragile and intellectually disabled consumers. Our group support our clients' rights to live in the community, and we support the Lanterman Act. We want to be more involved in their care and be more involved in policies that may impact our delivery of service to our consumers. We can start by welcoming us as the newest member of Lanterman Coalition if it is not yet too late. Lastly, please help the small minority business owner who operates the small care homes across California and who have dedicated their lives in caring for our physically and intellectually disabled citizens. Please save the 6,000 care homes here in California. Thank you.
Thank you very much.
Hi, my name is Michelle Richmond, and I'm an Early Start Service Coordinator in San Joaquin County. Currently, I have a caseload of 88 infants and toddlers. I want to let you know that I do support the Early Start program, restoring the criteria as it was in 2009. In the past 6 years, I've seen a lot of children leave the program or be denied services the first time they're referred, and sometimes the second time they're referred. For example, Gabriel was referred to Early Start at 4 months because he wasn't yet lifting his head well on his own. His mother has an intellectual disability and is a VMR, a Valley Mountain Regional Center consumer, and all 4 of Gabriel's siblings received Early Start services when they were young, and 3 of which are still getting special education in school. Even though Gabriel is likely to have developmental delays really young, he was denied services the first time he was referred. Jen and Samantha are twins born at 32 weeks gestation premature, and they were referred at 6 months of age to the program. Jen, in particular, was having seizures that could not yet be controlled. And so
1 minute.
Both twins were at risk of having developmental delays, but yet they were denied services. So please fight for reenacting that, reinvesting in that. We spend less money now than we will later on their services, and our children are very valuable resources. So thank you very much.
Thank you very much. Hello.
Greetings. My name is Teresa Brakefield. I work for Valley Mountain Regional Center in Stockton. I'm a SEIU union member. I'm on the executive board for SEIU and DDD Industry Council. I support the Lanterman Coalition. Recently, there has been a great service coordinator turnover at our regional center. And I hear all along the way that it's because all of these reasons that really are not pointing to the real reason that they're just not getting paid. We've had 13% turnover since January, and most of the regional centers left because they're not making enough to take care of their families. It's really quite disturbing. So I just wanted to let you know.
1 minute.
I'm done. Thank you very much.
Thank you very much.
Hi, Carol McKinney with the California Supported Living Network, and I'm fortunate to participate in the technical work group regarding the minimum wage increase, and really appreciate that DDS is willing to have us at the table to work on this. We do have a concern about the interpretation of the trailer bill language. Currently, it doesn't speak to the law that requires employers to pay twice the minimum wage for exempt employees. When the minimum wage increases, I will be required by law to increase my exempt employees' salaries. So I would like to encourage you to have further discussion regarding this.
Thank you.
Madam Chair, Doug Pascover from Marina. The first thing I wanted to say is congratulations on getting Peggy Collins to take that chair. It's a real comfort having her understanding back in service.
She's going to give you an extra minute for that.
I don't think I'll need it.
Or maybe 1 last minute.
But can I have those 10 seconds? I also wanted to speak in favor of the stakeholder process that Secretary Dooley mentioned, not only with regards to moving people from the developmental centers, but also because during the years of cuts, the system has changed a lot, largely without a plan, mostly without monitoring. And during that time, many of the people we serve have been born, and the rest have gotten 12 years older. And I think it's important to take a second look at the needs that we need to address.
Thank you very much.
Marty Emoto, California Disability Community Action Network, CDCAN, also a family member, and it's good to work with you again, Senator. We've worked together on the access legislation. And,
great to see you.
And also great working with Peggy, who has, I'm sorry, I just got tongue-tied. But
She's
anyway,
a rock star.
Yes, and also appreciate the fact that you're doing this hearing and listening to people, because we know this is part A of a two-part hearing, and it seems like we've gone through the entire alphabet. So I just want to say, first of all, urge the legislature to adopt trailer bill language, to convene a stakeholder task force through the Department of Developmental Service to really get people together to look at rebuilding the system, looking at what funding, to prioritize, what programs should be restored in terms of funding, and look at other ways to rebuild our systems in terms of new services, and to get a report back to the legislature by the end of the year. I think that formal process is needed to bring everyone together. Also urge, as part of the larger effort for child development and child care, that the legislature is looking at to restore early start, and also because it covers a wide range of people with disabilities, including people with developmental disabilities, restore the cost of living adjustment for the SSP that is due in January, and also to reject the governor's cap on IHSS and fully fund the overtime. Thank you.
Thank you very much.
I promise I'd talk fast. Jackie Dillard-Foss with the California Supported Living Network on shared employment, because it is much more complex. I would request that we have language that clarifies that a provider of the regional center and a provider of IHSS, that we are not in a co-employment relationship, and we really appreciate that in statute. Thank you.
Thank you very much.
Hello. Hi, Nancy Chance, Choices Transitional Services and California Disability Community Action Network. I want to say that I support what Jackie just said. I support what Marty just said. And then I would like to say that, it's not that we don't think people that work for us need a higher wage or that they don't deserve overtime, but we can't be expected to provide that if we don't have the resources to make it happen. And also to please keep remembering that this is a very complex issue for regional center vendors, for supported living especially. It's not just $1 onto somebody's hourly wage, and it's not just some overtime. So please keep that in mind as you go forward. Thank you.
Thank you very much.
Good afternoon. Mary Jan, California.
Here, push your red button.
Oh,
there you go. Is it on?
Yes. Good afternoon. Quickly, Mary Jan from California Association of Health Facilities. I just want to highlight that the minimum wage impacts also the over 1,000 intermediate care facilities that are funded through Medi-Cal. And then just to augment the DDS budget, note that a number of these facilities are facing possible closure when Medi-Cal imposes further cuts via AB 97. And I have a little document I'll leave with you about that.
Thank you very much.
Hi, good afternoon. My name is S.P. Sorongan, and I am a nurse and a service provider for a 962 home, which opened in 2009 through Golden Gate Regional Center. And I have worked for nearly 20 years in various healthcare settings. Most of those years were spent with a nonprofit long-term care facility run by the city and county. Up until I started to work with Regional Center team, that I experienced firsthand the immense level of dedication and commitment of the Regional Center staff to do their work, and how quickly they respond to provide and ensure that the care delivery of our consumers are not compromised nor delayed. From leadership staff, social workers, to staff of office staff, they genuinely take pride with what they do and focus on the mission of their organization with consumers in the center of their core duties. Therefore, together with our consumers at Gordon Home, we are asking that you consider to approve their budget request, or we will lose more of them as they seek outside employment. Thank you very much.
Thank you very much.
Good afternoon. My name is Janelle Lewis, and I'm here on behalf of FEAT today, Families for Early Autism Treatment. We're a volunteer-driven organization in existence in the Sacramento area for 20 years, helping families affected by autism through education and advocacy. And we have repeatedly seen that investing in early intensive services pays huge dividends in the end. You've heard this over and over again, but I wanted to reiterate that...
Well, I also agree with you.
Yes, thank you. that, we're strongly in support of restoring Early Start to its previous levels for eligibility. Also, we believe that all individuals deserve to be included in their communities, and it's been devastating for families that we work with to lose their access to recreational and social services through the regional centers. So we strongly support that also. And lastly, just that the copay insurance deductible issue has been devastating. I know with my own children, we would not have been able to have the early intensive services if we had had to pay those.
Yes, we are very seriously looking at that issue too. Thank you.
Hi, I'm really nervous to come to this podium.
Don't be nervous.
If I will not speak today, who will gonna speak for our client? My name is Nemia Atendido, and I am a service provider. I have a level 3 ARP home with 6 clients living in our home. And the rate is really low, only $2,512. The total is $15,000 a month. I know that the federal minimum wage will gonna increase in July 2014. Wage is $9, but there are some counties like San Francisco where where the minimum wage is 10.75. In that minimum wage, our salary, the staff salary is increased to $7,000. And our mortgage rate is $4,000. We have tax, we have grocery, we have, and as an owner, how can we survive to continue our service to individuals? We are not getting enough salary. We are serving them as free. Sometimes we want to give up the home, but we feel sorry with our clients because they are like our family. I'm supporting the 7.5 increase. Thank you.
Thank you very much. Hello.
Good afternoon. My name is Doreen Canton. I'm a registered nurse. I worked at Golden Gate Regional Center. I also worked at Health Plan of San Mateo. I echo many things that have been said today in support of Early Start and Regional Center and funding, and etc. But I also need to advocate for the medically fragile individuals who live in our communities, who are as medically challenged as those that live in developmental centers, and more so But the crime is that they do not have access to the wonderful 24-hour nursing facilities, the small bed facilities that have been created both at the ICF level and the SB 962 level. They don't have opportunities to go there. Instead, they have to go to skilled nursing, where staffing ratios are not appropriate. They don't have the training, they don't have the skills to meet the needs of these individuals. So we need to develop community resources for the people who have never gone into the institutions but have lived with families and in facilities in the community. Thank you.
Thank you very much.
Good afternoon, Senator. Eric Stern. I'm a case manager at the Regional Center of the East Bay for the last 13 years. Pleasure to see you in this setting.
Yes, you too.
I also serve as the chair of the SEIU California DD Council, representing 10 regional workers at 10 regional centers and 7 provider agencies. We thank you for your support of this community. We're looking at making sure we stay up with a minimum wage. It's really a crime to have that conversation. No one who works in this field should work for such low pay. We need to be able to pay people to have a career in this field. We need a stable workforce. Our providers are often working 2 or 3 jobs. I think you've heard that. We have job developers who get hired at the job settings where they're helping people to actually be employed. The issue of wage compression is huge. For 25 years, I'm wrapping. For 25 years, we've starved this system. Originally case managers were all supposed to be master's degrees. Now they're hiring bachelor's degrees. In Alameda County, the pay for the equivalent pay of what a regional center case manager gets is entry-level AA degree. This is where we're going with this system. So, thank you very much.
Thank you.
Gregory Chair with the Arc United Cerebral Palsy. Concerning overtime, if the legislature adopts the administration proposal, it will result in more rapes. I can say that with certainty because when I used to work for the Senate Office of Research.
You don't have to, well, I probably shouldn't say this, but you don't have to convince me it's not the greatest idea I've ever heard.
If you want the research to support that, I can provide it for you.
Thank you very much. Thank you. All right, any other public testimony? All right. And as we said earlier, all of these items above, except for the first that we voted on, will remain open. So now we're going to move to the second part of the agenda, agenda item B, and I'd like to ask the director and his, are they assistant directors or deputy directors to come forward? Did she take all my notes? Peggy. Did you grab all my notes? Oh, okay. You hold on to them for me? Okay. All right. Item B.
Do you need me to have your office bring it down?
Yeah, I know.